Okay. Okay, so with regards to exam 3 reviews, okay, that was from this announcement. So we've already had 2 of them. Okay, I did one on Tuesday, in which I've already shared the recording. Professor Ford did one yesterday, but nobody showed up. So there's no recording of that. When we don't have anybody show up, we don't do a review. So far you only have 1 recording. Okay, and that's from me on Tuesday. And then the last exam review is Sunday with Professor Kershaw. Okay, so you get one exam review left to go to, and you'll end up with 2 recordings. But she doesn't do hers till late Sunday night. But you guys aren't testing to Friday, so you'll be fine. I want to go through this roadmap. Okay, so everybody had a look at this announcement from the weekend. Okay, this is a roadmap. Okay, so I know we're already into Friday of week 9, but this week's busy. Okay, so I've gone through the roadmap of the next 4 weeks. Okay, so this week, if you haven't already done it, you have an NCLEX, you have a case study, and then your HESI prep assignment is due on Sunday. Okay, a lot of you have already turned it in. That's great, but you have till Sunday to turn it in. And then, of course, if you can attend the last exam review on Sunday, that'd be great. So those are your 4 things for this week. And then Monday starts, next week is another busy week, right? You've got your vulnerable populations assignment due next Sunday. You'll have your exam next Friday. And the other thing for next week is you will have the opportunity to attend a HESI review. Okay, since it's during exam week, we can't do the HESI review during class. So it's done at additional times. And that assignment or that announcement has the 3 HESI reviews in there of when they are. So I would encourage you to try and attend a HESI review next week if you can. I know it's exam week. And as we talked about at the beginning of the term, weeks 9, 10, and 11 for you guys are super busy. All right, that's why I wanted to put it all together now for you. Okay. And then you jump right in from exam week next week, right into the HESI. Now, have I already given you guys, do you guys know when your HESIs are scheduled for?
15th.
Have I given you those dates?
15th.
I'm sorry?
It's on the 15th.
Yours is on the 15th. I'm asking everybody.
Okay.
Did I give you guys that? I probably haven't. Do people know when their HESIs are scheduled for?
I think ours is the same day of class on campus.
Okay, so I guess my question is, has campus reached out to you for when your HESIs for community are to be, or the days and the times?
Yes.
Okay.
Norfolk students.
What about everybody else?
The Norfolk students haven't gotten ours.
You guys haven't gotten yours. Okay.
No.
I'm going to pull, I'm going to pull something up here and see if I can see Norfolk. Is there any other campus that doesn't know? Okay, just Norfolk. Let me see if you guys are, let me see if I can pull yours up here. But everybody else knows what day you're scheduled for.
No, I don't know mine.
Okay. All right. All right. Let me see if I can pull this up. Oh, that's not what I wanted. Composite exam schedule. Okay. So I heard Norfolk. Let's see if Norfolk has theirs up yet. Yes. Well, okay. For those of you from Norfolk, your scheduled day is Thursday, the 14th at 12 p.m. That's what your scheduled day is for. That's what's on the master calendar. What other campus?
Is that the 7th?
I'm sorry.
Is that the 7th?
No, I just said the 14th.
Oh, I'm sorry.
It's okay.
I was
This is-
thinking next week. Okay, yeah.
Yeah,
Thank
next
you.
week. Yep. And what other campuses need to know?
Cincinnati.
Scranton
Cincinnati.
and Scranton when you get a chance.
Okay, Cincinnati. Okay, Cincinnati. Looks like you guys are scheduled for Friday, the 15th. And the times say 1 p.m. and 4 p.m. So I don't know if that's a 1 p.m. start and a 4 p.m. start or any time in between 1 to 4. But that's the day and that's the time. Your campuses will let you know.
Professor,
other
for Coral Bay, Florida.
Cutler Bay.
Yeah.
Okay, Cutler Bay. Thursday, the 14th. It looks like it's being given at 2 times, 9 a.m. and 5:30 p.m.
Yeah. Thank you.
Mm-hmm.
Professor
Scranton.
Columbus.
Columbus. Columbus, okay. Looks like you guys are on Friday, the 15th. And it lists 2 times, 9 a.m. and 9
Mhm.
p.m. That's Columbus.
Okay.
Okay, what else?
Scranton.
Scranton. Scranton. Looks like you guys are scheduled for Friday, the 15th at 1 p.m.
Thank you.
You're welcome. Who else? That everybody? Cincinnati, Columbus, Cutler Bay, Norfolk, Richmond. Richmond, do you know when who's from Richmond? Do I have anybody from Richmond? Yeah. Sibby.
15th.
Sibby,
15th.
you already know. Okay. Awesome. Okay.
Is Sibby there?
I thought I saw Sibby.
Where is he? I messaged him, but he's never late.
I'm here.
Okay, cool.
Mhm.
Oh, it's so nice. You guys check on each other.
Thank you, Elia.
Sibby, you know when yours is, right?
Yes, ma'am, 15.
Okay.
Yeah.
So in the near future, your campuses should be reaching out to you of how to schedule it. Okay. I'm just simply providing you the day and the time. I have nothing to do with scheduling. I'm just trying to kind of give you a courtesy heads up of when it's scheduled for. Okay. And are you starting to get the other times your other classes HESIs are?
Yes. The
Okay.
schedule is on the door.
Great,
It's there.
great. Okay. So your job now, everybody, is to get signed up for it. Okay, they're all being this group, everybody's doing it on campus. Okay.
Mhm.
So reach out to your campuses, get yourself scheduled. And the only thing I will tell you with scheduling from past experiences from students, when you're scheduling and your campus should be telling you this, make sure you're in the right cohort. If you're not, if you haven't scheduled yourself in the right cohort, it's not even going to pop up for you to schedule. Okay. So, okay. So let's go back to.
Oh, God.
Oh, let's see. Okay. So that's your HESI. I would highly encourage you to try and get your remediation started as soon as you finish your HESI, since you're going to have multiple remediations. I attached a copy of the remediation guidelines here at the end, and those are the hours required for the score that you get. You guys have seen these before and you know what remediation guidelines are. So that's, I sent you those. Okay, so if you score 900, you do this many hours. If you score a 600, you do this many hours. And you all know you're given a remediation packet after you take the HESI, right? Okay. What else? Remediation needs to be done no later than Monday the 18th. Okay, there's no exceptions. If you don't complete if you don't complete remediation, you'd get a 0 for the HESI. So a lot of you are taking them on Thursday and Friday. So I don't know if other ones are earlier in the week that you can do your remediation for them earlier in the week, but try and get them done as soon as you can. I don't post any HESI grades in the grade book for you guys to see until your remediation is done. And we'll talk about that as it comes, but please try and get your remediation done. Okay. The one thing I want you to remember about week 12, week 11 attendance is the simple fact that you took your HESI. That's how you get your attendance for week 11. Week 12, you do have to come to class. I know it's the 22nd. I know it's the last day or whatever. However, you just have to show up to class. We don't stay, maybe 10 minutes, but it's to track your attendance for week 12. That's how you get credit on week 12. All right. So we don't stay long. We kind of do end of term advising and talk about the HESI, whatever, but you got to show up to get attendance. But it's not long at all. All right. Now, if you are already have attendance issues, and that you know that if you've gotten a letter from Dean Brown, you can't blow off this class because you can't. Because if you end up blowing off this class and it puts you over the week 12 class, puts you over the 20%. And I do have some students in this class with attendance issues. If you go over the 20%, then that's a full letter grade drop. Okay, so that's why I highlighted it and bolded it. You just got to show up for the beginning of class. Okay, it won't be long, but you got to show up. All righty. Anybody have any questions about that?
I
Go
have a
ahead.
question.
Go ahead, Alina.
So when we finish our remediation, right? So
Mhm.
do we have to email you that we finished it,
No,
or
no, we'll talk about, no. I mean, you could email me when you're done. I'll go in and double check it to make sure it's done, and then I'll post your grade. So yes, if you want to email me, that's perfectly fine. I usually that week check everybody, how they're doing with remediation, once a day. And if they're done with it, but a lot of students do email me and say they're done. Yep, that's perfectly fine. It gives me a heads up to go in and check. Yep. Good question. Thank you. What else? What other questions you guys have? Nothing? Okay. Okay, let's go in and take, let's see, what time is it? 9:20, 9:18. Let's go in and take until 9:35. So about 15, 17 minutes. We'll take quiz 5 and then we'll go over it. You got to keep your cameras on. Everybody can go on mute. Got to keep your cameras on. It should be open. I reopened it this morning for today's date. Stay on camera. And then make sure you submit when you're done. And then we'll see you in about 15 minutes and then we'll go over it and then do the rest of what we need to do. Okay. Anybody still working on this? Okay.
Yeah.
Okay. One more minutes and then please submit when you're done. Several people haven't submitted. Aaron, are you done? Okay. Leah, you done? Okay, so everybody's done and everybody's submitted. Okay. Okay. Let's go through it. How'd
I'm
you
not
do?
done yet.
Oh,
Regina's not done yet.
okay, Regina. Okay. Let us know when you're done.
I'm done.
Okay, thank you. All right. How'd you do? And this is going back, what?
I'm sorry. I'm honestly upset with myself because if I didn't second guess myself, I would have a higher grade. I am so upset with myself.
Haven't we already talked about this?
We did, and I'm real upset over it because there was two of them that I went over and I second guessed myself on. I am so upset. But I feel like I'm ready for my next exam. I'm just really upset with myself.
Okay, good. I don't mean good that you're upset with yourself. Good you're prepared for the next exam. So let me take a page out of that book. Okay, second guessing yourself. If you're gonna
Yeah.
change something, I've said this before. Pardon me, if you're gonna change something, you better be darn sure that the reason why you're changing it is pretty concrete, right? It can't be, I think I read this somewhere. I think she said this somewhere in lecture. I think I heard this somewhere. You can't. And I can tell you over the reviews I've done with numerous students this term, the two biggest issues that are coming out is second guessing, meaning changing your answers, and then overthinking. Okay. And so remember, if you're adding information into the question to try and find the answer that's not there, it doesn't exist, right? So if you're adding certain things in there, don't add to it. Everything you need to correctly answer the question is right in the question. Okay? So I can't stress that enough. So the two biggest common issues that I discuss with students when we're doing exam reviews. Okay, let's have a look. Okay, can you see my screen? Okay, question number 1. And remember the concepts we're covering. So if you remember the concepts we're covering, you should have been able to pinpoint this one. School nurse notes several children developing a pustular rash on their face and extremities following several days of fever and malaise. Which is the next step the nurse should take? So what's the correct answer?
Notify the authorities.
Notify the authorities.
Of smallpox.
Yeah.
Okay.
Mm-hmm.
Okay. Anybody answer anything other than A on this?
I did. I put assess the vaccine records.
Okay. So why is that wrong?
I have no clue, but I was going back and forth.
Right. But are these symptoms of chickenpox? Or are they more symptoms of smallpox? Smallpox. Okay. We certainly wouldn't recommend to follow up with the pediatrician when they're better because they've already had several days of fevers, right? That would be an inappropriate answer. And evaluate scalp for excoriation marks.
And that's
And
for life.
Yeah,
That's
these aren't symptoms of lice. Okay. So here you need to understand what the initial symptoms are of smallpox. Plus, one of the concepts we covered were bioterrorism and disaster, where smallpox falls under. Okay, the nurse is caring for an immigrant who is pregnant with her first child. No vaccination records available. Which vaccine should be prioritized?
So I was confused in this one because I know Tdap is given and then influenza can be given after birth. So you just kind of broke this up. So I was like, oh my God, which one is it? So rubella, I thought can be given after the child is born. And influenza I didn't think of. So I said, maybe it's measles. So I wasn't sure about it. You broke it up. So I just got confused.
You're overthinking. Way overthinking. What's the right answer, guys?
It's
Rubella.
And why is it rubella? Let's educate Aaliyah on why rubella is priority.
Why is it priority?
Pardon me?
I'm waiting.
Oh, no, go ahead. Anybody jump in. Why is rubella the prioritized vaccination? You guys should remember this from OB.
That's what I was thinking. Rubella I remember we gave it when
Isn't it because it can spread directly from contact to contact immediately or something like that?
Part of it, yep.
Mhm.
Keep going. Come on, you guys got it right. Why did you pick it?
Is it also because she's an immigrant and she's coming from somewhere else?
Yes, that's part of it.
What I thought is like,
Pardon me?
if
Go ahead,
if we give a rubella, it's a bundle of vaccines. It covers like 3 different, like measles, mumps, and
But that's Tdap, right?
That's Tdap.
So rubella, it means Tdap?
No. Rubella, it's itself.
Is it because it's supposed to be the first dose between the 12 and 15 months of age?
Okay. It's also live,
yeah, it's a live vaccine.
right? Right. Okay, question 3. The health department is caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education should the nurse provide? What's the correct answer?
Call to report
Call to
any
report.
Call to report.
Call to report. Okay, why is A wrong?
Why is A wrong?
Because you finish the antibiotics no matter if you feel better or not.
That's exactly right, Caitlin. You got to finish. You don't just stop when the symptoms are gone.
I'm sorry, I have a question because I'm still confused on the rubella. I just feel like you're not supposed to give them. I thought you wasn't supposed to give it to them if they're pregnant, like a live vaccine.
Yeah, that's what
This is more of protection for the baby.
Okay.
But Miss
That's why I was just so confused.
Marvel, we gave rubella shots after the pregnancy, after they had the baby. I remember giving the rubella shot to the pregnant lady in our clinicals. That is why I didn't choose that.
You remember giving what?
I remember the nurse giving the rubella shot after they had the baby. Because she hadn't had one. Because she hadn't had it. She hadn't taken the rubella shot. Probably that's why it was okay to give it. But basically, she probably needed it. That's why they gave it to her?
Correct. Yeah, correct.
Was it
And
rubella
remember,
or was it Rogam?
we don't have any vaccination records, so it's not to say that the others aren't needed, but which needs to be prioritized. The others are definitely needed, but that's not what the question is asking. It's asking if you were going to give one, what should be prioritized, and that's the rubella.
So if we was to get a question like that on the HESI, that would be the correct answer, basically. Okay, so understood.
Correct. Correct.
All right.
Okay, in question 3, what is wrong with answer C?
No need to interrupt actually. When we just don't tell them that.
Why is that incorrect?
No need to interrupt.
Why didn't
The
you guys pick
partner
that one?
might not have gotten treated.
Pardon
You
me?
don't want to spread gonorrhea around. The partner may not have been treated if they're only
Exactly.
with one person. If they haven't been treated, you can just keep passing it back and forth.
Exactly. Exactly.
Mm.
Yep. Okay, the occupational health nurse is caring for a client who just sustained a needle stick injury at work. Which education should the nurse provide with regards to HIV testing? What's the correct answer?
Return for another HIV test in 3 months. And this was in the notes. This is a factual thing. We couldn't have guessed it.
Okay. And why C the correct answer?
Because it doesn't determine it in the first go. It takes time.
It potentially takes time. Correct. Right. So a positive serology with HIV can take up to 12 weeks.
Mm-hmm.
That's why we do it in 3 months. We retest in 3 months. Okay. All the other answers indicate that that this first test, you'll get your results. But no, we have to wait and do another test in 3 months.
Mm-hmm.
Nurses developing a primary prevention program for tuberculosis. Which intervention is appropriate?
So I goofed up here.
Okay.
To me, teach the residents because it's
Reduce crowded living conditions.
Okay, say that again.
I chose reduce crowded living conditions.
Right.
That's the answer.
That's the answer. So, Kayla, why is that the right answer?
Because the more people you have, of course, the TB is possible for spreading more. So as you limit it, how many people or the crowd that you have in the homeless shelter, then that's better.
Right. And you're looking for a primary prevention. So you're looking at prevention. So you have to go back to the root, right? Where might that start? What environment might that start in?
So why wouldn't one be? We're teaching residents, right, of homeless shelter, we're teaching them the signs and symptoms. So if they knew the signs and symptoms, they would automatically not live in those crowded areas.
Kayla, what's A? Primary, secondary, or tertiary?
Is that one secondary because it's a teaching?
Not teaching. Screening. Right? Look at the environment.
Yeah. Yes.
Right? The environment. Look at the environment they're in. So that is an at-risk environment. Right? So you've screened for that to be an at-risk environment. So then you do the education because they're already in an at-risk. So remember, secondary, early identification, early intervention. So you've identified the homeless shelter as a high-risk environment and you do education. Okay, so you've screened. You're screening. Does that make sense, Aaliyah?
Okay.
Okay. Yep. So that's secondary. What about B? What's B? Primary, secondary, or tertiary?
Discuss ways to minimize side effects. It's a
tertiary.
Tertiary.
Yannette, tell me why it's tertiary.
It's because he had diagnosis
Aaliyah, hang on.
He had diagnosis already. He's teaching about the medication.
Exactly.
Mm-hmm.
Exactly. Okay, and what's D?
It's primary.
Primary.
No, the
B. No. D is secondary, right? What are we doing?
Yeah.
We're obtaining a TB skin test. So it's like a screen test.
We're screening.
Screening, yeah.
right?
Yeah.
Stop
Okay.
before you spill it.
Okay, the home health nurse is visiting a client and who's recovering from a right hip replacement performed 8 days ago.
Grab
Client is
that cup on top. The cup on top.
the client is complaining of calf
No.
pain in the left
The
leg.
cup up there.
Which nursing? Hang on, Kayla, I'm going to mute you. That's okay. Okay. Which nursing intervention is a priority? All right. So before we answer this question, what are we going to pull? Let's say you were using your highlighter during the exam. What words, phrases, cues, hints, whatever you want to call it, what would you
Priority.
highlight in this question?
Priority.
Okay, that's
Calf
one
pain
word.
and calf pain.
Pardon, calf pain. Yep. Okay, that's something
In the
else to
left-
highlight. What else are you going to highlight?
In the left leg.
Left leg doesn't matter. Calf pain. There's a lot you can eliminate in this question that you don't really need. What's priority that you need in this question? You need the word priority. What else is important? Calf pain, somebody said that. There's one other thing that's
Intervention.
important.
Intervention.
Okay. Intervention, yep. Okay. Okay. What else?
Assessment.
Eight,
No,
they've had
it's
surgery 8 days
surgery.
ago.
It.
Okay, so
then
8, hang on, Aaliyah. 8
Oh.
days ago, that's a while. Okay, that's over a week post-op. Okay, what might you be thinking potentially is going on here?
So Miss Marvel, I clicked that, but what threw me off was priority number one. That threw me off, and then the breath sounds for abnormalities threw me off. But when you're explaining it now, it makes more sense that I should have taken that first answer. But you see,
Let's think about taking your knowledge and applying clinical judgment. What you're looking at in this question is a potential risk for a blood clot. That's what this question is setting up for, a potential blood clot. Okay.
Yeah,
So
sense.
what is the priority to do for a potential blood clot? You're going to assess the left calf.
Yeah.
Yeah. Okay. B's not correct because the question doesn't even address
Yeah.
drainage from a hip wound. Okay. We're talking calf pain. Calf pain is a high risk red flag for blood clot. Right? Pain medication, we wouldn't be discussing the use of pain. We may be after we've established whether this is signs and symptoms of a blood clot. All right, same with D. Okay, so the question is asking what's the priority? Priority is to assess for edema. Okay, does that make sense?
Yeah.
There's lots of cues in that question. Home health nurse is caring for a client with chronic peripheral artery disease in both legs. What are you going to include in the education for the client? When you read about, when you read about peripheral artery disease, okay, what is that? This is going back to med-surg. What is it?
Your heart, your perfusion in your artery
Perfusion.
is not enough. Perfusion.
Yep. So what are we going to encourage for teaching?
Stop smoking.
Stop smoking.
Correct.
Mhm.
Correct. And the other three, I mean, the other three don't it's asking for, the other three really don't apply. The other three apply to other conditions, right?
Yeah.
Okay, COPD. Which dietary modifications should be used by a client with COPD?
So this was written in the concept, rest before starting a meal. I kept going back and forth with that, but I kept reading which dietary modifications. So I'm like, is the question asking me that what they shouldn't be doing? So I got confused in this one. And then I wrote eat 3 large meals because that should be modified. That should not be done. So
It's not about the diet. It's about breathing. COPD is about breathing.
I knew that. I knew it was rest before starting a meal, but that was in the concept paper. It was there. It's written over there. But I just went back and forth with this because of the question.
Well, I hear what you're saying. I hear what you're saying and how you could be confused. However, when we say dietary modification, it's not necessarily the food, it's the routine. Okay, so during meals, what are we going to do for a COPD client? Now, if you chose A, let's sort that out, because that is an incorrect answer. Why is A an incorrect answer?
It sounds incorrect now, but then it says diet modification. I thought it meant that they shouldn't be doing that.
I'm sorry. The A is you need oxygen, cannula. You O2 is low. You need all time.
What?
Right. That's too much work. Eating 3 large meals per day is too much work.
Yeah.
For this client, right? And we certainly wouldn't remove the oxygen cannula while eating,
No.
right?
Mm-mm.
So with a COPD, we encourage them to rest before starting their meals. So I guess, Aaliyah, if I rewrote that question, it would be, which modification would we use during mealtime or something like
Right.
that, right?
Yeah.
Okay, but again, you're thinking too much.
Mhm.
You're thinking way too much.
Mm.
Home health nurses caring for a client with cirrhosis who lives alone, which your intervention is a priority. What do we know about clients with cirrhosis? What are some risks
They-
for them?
They become weak and they are unable to hold their balance. So we have to make sure that they evaluate the gauge and environment for fall risk.
Yep. Did anybody choose anything but that? Again, this is taking your knowledge and applying clinical judgment. These are med-surg questions. These are clinical judgment questions.
And I've seen
Anybody?
these patients, Miss Marvel, I've seen these patients in the hospital. So I kind of can put that together as well.
Yep. Anybody have anything to add of this is a good, we've had a lot of these questions. These other answers could be correct as well. Okay, some of them. And so if it's not a select all apply, you got to go back and read what you missed in the question. In this case, it would be priority, right?
Mm-hmm.
Because all these other things need to be assessed as well. But the priority is first and foremost, like Aaliyah said, these clients typically are fall risk.
Mm-hmm.
Okay, which food should be avoided by a client with poorly controlled hypertension?
Cane soap.
Canned food, canned
Okay.
soup.
Yannette, why?
Yeah, but the problem.
Sodium.
Please, excuse me.
Aaliyah, hang on. Go ahead, Yannette.
This problem is the high sodium.
Yep.
Yeah, it's like 200 grams of sodium in it.
Yep. Okay, so for those of you that missed some of these questions, do you have a better understanding of why you missed them?
Yep. I like to do these reviews. They help me so much.
Good. Okay, let's review our concepts for this week. Okay, we've got 2 concepts left to cover. We've got human abuse and violence, cultural influences in nursing. So there's lots to be said for human abuse and violence. In our nursing career, we are going to be taking care of clients, okay, who either may be victims of violence, they actually may be perpetrators of violence, or they may be witnesses of violence. Okay, so what kinds of in your readings, in your preparation, give me some examples of different kinds of violence you may be caring for with clients. What does this mean? Maybe
Like
child abuse, child neglect. What else?
violence in the house or violence where?
In general, I mean, think about it. Think you're out in the community, what kind of
War crimes and
Got-
war, rape.
pardon
Gets
me?
raped. But rape. Children get raped, women get raped,
Mhm,
the war times,
mhm. Human
Violence.
trafficking,
human trafficking.
assault. What else? What other kinds of violence may be
Abusing the assistance facility,
Yeah.
the old people, elder people.
elder abuse,
Mhm.
right? What else? Brought domestic violence,
Verbal abuse is, yeah.
intimate partner violence, maybe children witnessing violence.
Mm.
And I think I said human trafficking. Okay, we know that violence is a maladaptive coping mechanism. I'm just reading from the notes now, right? Vulnerable populations are certainly more at risk. Okay, why? Why are vulnerable populations more at risk to be exposed to violence, either as a victim, a perpetrator, or a witness?
Because usually they are either weaker or disabled.
They don't have
And people
resources.
feel like they can take advantage of that.
Exactly. Excellent. Yeah. Makara, can you turn your camera on? I hate to even say that. Sorry. Thanks. What else? Makara, that's excellent. Excellent. What else?
They just feel that people think that they can just do anything to them because they don't have the resources and they have limited resources and they won't go very far, even if they're abused.
Do you remember? Go ahead.
Mm-hmm.
Who else was going to add in there? What causes? What are some of the high risk factors that increase this? Maybe substance abuse,
People
addiction,
that have no support.
no support, poverty,
Mm.
limited resources, previous involvement,
Mm.
right? What else? What did you read in your notes? We are mandatory reporters. We all know that, right? What does that mean?
No matter what the abuse, we have to report this crime. We
Okay.
don't need it. We don't have to do anything. We just have to go and report it. We can't
Okay.
neglect it. We can't neglect it.
Okay, and does that include just in our workplaces, or is that anywhere?
Anywhere.
Anywhere.
Anywhere. Okay.
Mhm.
Okay. There's a couple of terms I want you to have a understanding of. One is physical neglect and one is an emotional neglect, and I'm here, down here. Okay. You need to know the difference between these two. Okay. Physical neglect refers to failure to provide the adequate essentials, right? So that'd be food, clothing, shelter, hygiene, necessary medical care. Whereas emotional neglect refers to the omission of basic nurturing, right? Basic nurturing, acceptance, caring for essential health, maybe growth and development. Okay? Does that make sense? We know that kids who are exposed to violence, okay, whether they're victims or witnesses, they're at much more high risk for developing mental health disorders down the road, right? Whether it be self-harm, substance abuse, attempted suicide, or completed suicide. Okay. We know that violence, abuse is about power and control, right? Like Makar said, it's usually the most powerful against the least powerful. right? A lot of times it's a cycle where kids have seen this growing up. Kids have seen certain acts of violence growing up, whether it's parents abusing each other, siblings, child abuse. Okay. And we know that kids are much more likely to perpetuate violence or tolerate violence in their own relationship as adults. And we start to talk about some causes for this. Well, economic strain, dealing with a crisis, maybe there's an unplanned pregnancy, unemployment, marital stress, infidelity, right? Those kinds of populations are more likely to experience violence. Social isolation. And then we have elder abuse. Right? They say that one of the best types of visits in the home for the elderly is a home health visit, because when you can get into that home and do an assessment, whether you're there for doing medication administration, you're able to do the other kinds of assessments. We've talked about this before. What kinds of you can do that risk assessment, right? Is there any neglect? Is there any abuse going on? Okay. You can read through the rest of your notes on the violence. I want to get into cultural influences of nursing. We've talked about this the whole term. Okay, so this is our final push with cultural influences of nursing. Okay. What does it take for us to be culturally competent?
We have to be comfortable with our own feelings first.
Yep. Excellent. Yep. What else? As you're moving, as you're going out and about, what is it going to take for you to be culturally competent?
Be more accepting of other people's cultures and treating them accordingly.
What else? I want to hear from others, please. So we're going to do an exercise after we talk about this, and everybody's going to speak. So what else? What else is important to that we need to have to be culturally competent?
We need to understand the basic needs of other cultures.
Yeah, you have to have the education and knowledge to go forth with what they need.
Cultural knowledge, right? Right. So we need to approach clients uniquely, right? Everybody is a unique individual. My culture isn't superior to yours, nor is yours to mine. We need to look at everybody uniquely, right? In a non-judgmental way. Got to check our own feelings. Okay. And this is a review question. Let's say you're working in a community that has different cultures that you're not familiar with. You're not familiar with the language. You're not familiar with cultural values, beliefs. What are you going to do? What would be most helpful to do? Remember, community nursing is a team approach. We're always looking to seek out key stakeholders, key players in the community that can help us.
Reach out to like the different organizations like the Hispanic Coalition or Jewish, different areas of the culture to try to understand their beliefs so that we can honor their beliefs as we're caring for them.
Yep. Excellent summary. Yep, because ultimately we want to try and incorporate, like Regina said, we want to incorporate as much of other cultures' values, beliefs, practices into the healthcare plan, right? We may not be able to do everything. And one student gave a good example of that in our class on Tuesday. But we may not be able to incorporate everything for health or safety reasons, but we are expected to try and incorporate as much of those values, beliefs, practices that we can, right? Maintaining an open, objective attitude, right? Avoid seeing people alike and looking at them as unique, being aware of our own cultural beliefs, right? Cultural awareness is really a self-examination of us, right? Or exploring our own biases, prejudices, if they exist, right? So what I want to do is go through, I've done this with my last two sections, it's been really informative, and I'm just going to go through as I see you guys. Let's talk about some cultural experiences that you've had. Aaliyah, let's start with you. Give me an example of different culture you worked with or barriers that you faced and how you overcame that.
Well, in the hospital I work in, we get Spanish, Hispanic people, we get Muslims, and we get a lot of Indian people as well. So because I'm from that culture, I don't really, I mean, I understand that culture. So I explain it to my nurses. Sometimes a pregnant woman, a Muslim woman has come to the floor and there's a male nurse assigned to the woman. So I immediately go to my charge nurse and say that this assignment needs to be changed. They are not accepting of a male nurse. So they appreciate that. So I know that, and I know that their diets cannot have pork in it. Most Indian people have vegetables in their diet. Hispanics, basically, they also have a very close community as well. So they're also pretty modest. You know, when you go to give them a bath, man or woman, they're very modest about everything. So I kind of know this, so I never really have problems.
No. So this is good. So Elias had working with lots of different cultures and had lots of different experiences and has increased her knowledge in several different cultures. So that's perfect. I mean, that's great. Thank you. Thank you for sharing, Yannette. What about you?
In my ILF, when I work, for example, I had the Chinese culture. It's not speak English, not speak Spanish. I'm trying to look my Google Translator.
Okay.
You know, to interaction with her.
Yeah.
And to the privacy, the Chinese culture is very privacy, you know.
Yeah. Yep. Yamela, what about you? You had any experiences to share about working with different cultures? And this could even be, I had a student the other day that she was the one who was educating her teammates on a particular culture.
I'm working on the palace too, so Daniel is my boss.
You
so
what?
It's the same. Janet is my boss, so I'm working on the palace too. So it's the same thing. So many people have different cultures.
Yeah.
So China, yes.
Yeah.
Yes,
Have you learned a lot about the culture?
Yeah, I'm studying.
Yeah. I mean, what do you do? And this is for everybody. What do you do if you are taking care of an individual or a client that is of a culture that you're not familiar with? What do you do?
You're a nurse. You don't think beyond that. You do what you're supposed to do and treat everybody.
Right. But how do you become educated?
I try research material online for about the culture, you know, for the preference, all material for the Chinese, Haiti culture, Latin American cultures. I had Russian people too, for the food, for the privacy. You know?
Aaliyah, hang on. Go ahead, Yannette.
For the food, preferring food, religions. For example, I had used people, I know it's not eat pork, you know, it's preferring food. I work for the resident and the family too, you know.
Exactly. You ask. And that was the other part of my answer is you ask.
Ask the family, you know,
You ask clients about their culture. What are their preferences? What are their beliefs? Right? Regina, what about you? Give us an experience.
Well, my experience, I'm trying to think. For instance, in home care and I had taken care of a lady. She was from here, African American, but she had married a gentleman from Mali. And I don't know how it happened because he didn't speak much English. And so I'm the one that actually, when he got his, his visa and everything to come across, I'm the one that picked him up at the airport. So there was like a little barrier there, but luckily a lot of the French is the same as Spanish. So I end up, we end up, conversating that way. I have patience to be able to try to understand. If not, I'll try to look up the material or like try to, I don't know, I talk slowly. Learn how to talk slowly to them. Try to ask them the differences. Use a translator.
Yep. Excellent. Yeah.
Just several different ways I try to communicate.
Right.
If not,
That's
I'll
awesome.
look up somebody in the, like, I got him into the ESL classes. I got him in, found him a job that he could speak, the French and stuff until he got his English more proficient and stuff. Yeah.
Wow. Wow.
Yeah.
Wow. That's awesome that you were able to learn so much about that culture. And oh, that's great. That's good. I bet it made you feel good too.
Yeah. I love helping people.
Yeah, that's awesome, Regina. That you actually went way above and beyond.
Yeah.
That's fantastic. Fantastic. Caitlin, what about you?
I used to work in a nursing home and I had a Asian woman who was on hospice, and when she finally passed, there was probably like 20 family members that came in. And I was gonna start postmortem care, but then I was stopped and they were like, no, like it's tradition that our like the children do it. And then someone like it kind of faced around the body, so I had to bring in like extra chairs and tables, and it was a shared room, so then I had to get the roommate out of there so that they had as much time as they wanted. So
wow. And nothing they were requesting was out of anything that you couldn't accommodate. Yeah. Wow. Yeah, so you got your education about that. Yeah. Wow, that's great. Sibby, what about you?
Okay, I found this on the web for What About You. Check it
Oh,
out.
sorry. Sibby, give us an experience. You're on mute if you're talking. There you go.
Yeah, before doing anything, definitely I will ask them, what do you want to do me? Okay. So one problem is with my language and speak, my accent is different, so it is difficult to understand them. So I know what is my limitations, so that before doing anything, I will definitely ask them what you want me to do.
Right.
So almost all problems will solve there.
Yeah. You got to get in there and know what they want.
Yes.
To see what you can accommodate. Yeah. Aaron, what about you?
When I was working in a nursing home, it was like 20 years ago. I had a family who was part of their family was Filipino and the other part was Chinese. And when this gentleman passed away, it's just like Caitlin said, they wanted to do the postmortem care and they opened the window and it was freezing. And they believed that if you left the window closed, their soul was gonna get trapped there. So they opened the window, and I was like 23 or something, and I had never heard of that before. And so of course I opened the window and I let them do what they needed to do. But it was a learning experience, but it was so neat to see the family come together and really take their time and say their goodbyes. So
Yeah.
that was probably one of my first really unusual experiences.
I had a student, I think in my Tuesday class, that had the exact same experience. Exact same experience. She talked about opening the window and letting the spirit out, and she just she said she sat there in awe, but she took it all in. As far as, so, again, we are going to experience taking care of different cultures in our nursing profession. There's no question about it.
Yeah.
No question.
I
So
also
how
point
do,
out the LGBT community.
pardon me?
I would also like to point out how people also can be a little bit iffy with the with the LGBT community, so they also are people that don't like to, who have different views, religious views. They kind of I've seen it, they're a little standoffish with
Absolutely.
the LGBT. They are. I've seen it.
Cultural insensitivity or cultural incompetence exists within our profession. Absolutely. And that's why we talk about how do we move past that? And Ali, you said this at the very beginning. First and foremost, working with different cultures, you've got to check your own feelings and your own beliefs and your own prejudices or biases if you have them. It's not going to work if you can't. Right?
Yeah.
Yeah.
And the patient
Erica,
immediately.
what about, hang on, Aaliyah. Erica, go ahead.
So my husband is Native American, and his grandpa he looks as much as you can like a Native American, but I was just going to touch on, you always want to ask if they have any preferences, because even though he is Native, he still likes direct eye contact when you talk to him. So you just want to always ask and find out what their preferences are before you just assume.
Yeah.
Yeah.
And that's a good example of, I know we're focusing on clients, but family, right? Think of all the intercultural families. You can get your cultural knowledge and cultural experience, not just from your clients and their family members, but from your own family. Right?
Talking about
Or even,
direct,
pardon me?
Erica mentioned direct eye contact. When I came to America, I had this problem too. Like, Americans want you to look straight at them. And I was brought up like, you don't look at your people. You put your head down and you don't just directly look. So that's very interesting at Erica's. Yeah.
Yeah. Absolutely. Jillaquan, you there?
Yes, ma'am. I'm here.
Okay. Give us a cultural experience you've had.
I mean, I honestly, I don't know.
Okay. Have you been listening to the rest of the conversation, the rest of the students?
Yes, Aaliyah was talking about how she's been super diverse, and Yannette, he said that he works with multiple.
No. So what we're asking is, what experience have you had in working with different cultures, and what have you learned?
I mean, I learned that you got to be patient with them. As of right now, I work at a call center. So I get many people throughout walks of life. And I just learned that you have to be patient with them. You have to be understanding. And you really just got to take your time, which is the same thing as patience. Because sometimes, people can't understand you, and people have certain values that they have to hold and respect. So you just have to make sure that you try to accommodate to those while you're still holding your same values. So you guys can meet in the middle. And then just always being open into listening, and always try to learn new things, because if you just have like a one-track mind and you're just like hard-headed and not really open-minded, then that's where a lot of conflicts come in, and that's where
Or if
we
you have
take
prejudices, yeah,
yeah,
you
and
gotta
that's
work through all that.
and that's where we take out the understanding, because a
Yeah.
lot of people eat understanding and a lot of
Yeah.
people don't get.
Yeah, excellent. Yeah, exactly right. Thank you. What about you? You're on mute if you're talking. Jeliquin, you need to stay on camera, okay? Thank you. Go ahead. You're on mute.
Sorry about that.
Go
So, as like people from different origin, from different background, they have their preferences. Like right by what Sivi said, that we have to be considerate and ask them to learn new things. Like we will never finish learning different culture, so it's a continued process. So, for instance, people from East Asia, they prefer a warm, uh, hot diet instead of cold thing what we are eating. So we have to ask them about. Yes, that's what research is about. They prefer warm food than cold one, especially when they're so.
And I heard from several students in my last two sections that a lot of family members of these cultures like to bring in the homemade food.
Yes.
Right? Right?
They do.
Yeah. Yeah. Great. Thanks. Giselle, what about you?
Yes, I'm work with because I am home LA. I've been working with different cultures. I'm being home. So I can see how different the culture they are.
Yeah, and do you ask if you don't understand?
Yes.
Yeah.
I always let them, know when I don't understand something, they told me, oh, do it like this, we don't do it like that, because it's different. I'm from Cuba, so my culture is different from
Absolutely.
the different house that I'm being.
Yeah, exactly. I mean, with as diverse as our cultures are now, and even me after being in nursing for 40 years, I'm still working on my cultural competence. Right? I'm still learning about different cultures. I'm still learning about all the different cultures of the students I teach. It's fascinating. Fascinating. Right? So it's a lifelong process. It really is. Montoya, what about you? What are you cooking?
Hi, I'm about to cook breakfast, but I'm washing the dishes
You
first.
cook me some pancakes for Jeff?
Yes, I will. My daughter might be a little loud, but honestly, I really haven't had an encounter with somebody from a different culture besides when I was a home health aide and
Okay.
I had a Muslim lady. She was my resident, and oh my goodness, I'm gonna go in here because she's loud. I had a Muslim lady. She was my resident, and they usually have their hijab and stuff like that on, but in her home she didn't have it on. And I had took her to one of her hair appointments, and the stylist that did her hair at the hair salon, she had to schedule her to where it was nobody else in the shop, just her, because I guess it's against their religion for other people to see them without their hijab on.
Yeah. Yeah.
And while I was there, it was one time her husband was there and someone knocked on the door, and she looked through the peephole and seen that it was a male. And her husband actually had to go to the door and open the door because she didn't have her hijab on. I guess other men is not allowed to see them if they don't have their hijab on.
Yeah.
That's the only experience that I have
Yeah.
had with another culture.
But again, it's learning. It's a learning process, right? And you will experience others as you move forward. But Kayla, what about you?
Honestly, I really haven't ran into the issue, but my thinking, of course, would be, to ask because that's the only way you're really going to know. And then, of course, learning through nursing school, of course, you want to do research on it. So
Sure.
that's my goal, to start researching on different ones and, things like that.
Okay. Good. So, right. So in the meantime, because I had a couple of students who, like you, haven't had those experiences yet, but they're preparing for those. Yeah. Okay. Malika, what about you?
I haven't really had any experience because I don't work in the hospital or anything, but listening to everyone's experience, it sounds very interesting, and
Yeah.
I love learning about different cultures and religions. Like even in high school, I had AP World History, and I found it very interesting.
wow.
So I feel like I'll enjoy all that experience.
And so what are you going to do to prepare yourself?
I would, if I don't know something, I would directly ask my patients open-ended questions, about the religion in a non-judgmental way. And when I go home, I would try to do more research on my own to learn more.
Yeah, absolutely. When I was in the schools for 20 years, I was in several different schools. We weren't site-based, so I would cover like a big pot of schools, 10, 12 schools. And it was amazing because we have a huge district. There's like 90,000 kids. So I was in all different areas of the district, and there were lots of different pockets of different cultures of families within those schools. So it was a wonderful opportunity for me to learn about different cultures with regards to kids and practices with kids and certain foods with kids and why certain cultures are not vaccinated. And over my span of 20 years in the schools, boy, did I get a lot of cultural knowledge and cultural experience with so many different cultures. It was fascinating. Devanya, what about you?
Yeah, it's just interesting.
Yeah, it's very interesting. Yeah.
I've worked a little all over. I've worked for Red Cross. I've worked for the ER. I've worked for doctors' offices. The places the communities I've seen is Amish community for mostly Red Cross. They make their food natural. They do not use electricity. They use lamps. I learned that instead of flushing toilets, they actually pour buckets of water into their toilet. So they do things a lot differently. I work with the Spanish community. I've worked with Jehovah's Witnesses who in the ER, they couldn't receive blood. So we had to figure out that situation. I've worked with Russians, mostly in the nursing homes.
Wow.
They're a little different. They're very direct. I've worked with Africans. I'm technically African American, but I've actually worked with Africans who speak French. So that was different for me. I've worked with Muslims. I learned that they do their funerals and their burials completely different. So that was a eye-opening. I actually went to a funeral for someone who was Muslim, and it was completely different from my culture. So I've been all over.
Yes, you have. That is fascinating.
Wow.
Wow. That's great. Magdalene, what about you?
Actually, I've had like one experience working on my facility. So being an aide in this facility, there's this one Japanese lady. She lives there with her husband. Actually, they are like sick together. So each time we pass like breakfast or lunch or dinner, the husband is bedbound. But she would not allow us to feed the husband because that was her duty, to be feeding the husband. She would not allow us to do that. She would be the one doing it. So also, being an African American, just coming here in our culture, we don't give this eye contact. If you're talking to somebody who is like an elderly person to you, you don't have to like look directly to the face, That's a sign of respect. So coming here and looking at people, like when you're talking to them and then they're like, okay, you have to look to me, you have to look nice, right? It was a little bit strange to me, but I just adapted to it.
Yeah. And that's a whole nother discussion of students with different cultures coming here having to learn the American culture.
Right.
It's everywhere. It's everywhere. And it goes in every direction, whether it's
Yeah, it was also a little bit difficult for me because I'm from the French background. So
okay.
like I think I speaking English also, you know, it was a little bit difficult, but
Yeah.
I think
Yeah.
I'm
Oh,
driving through that.
that's awesome. That's great. Ryan, what about you?
I mean, I work at the hospital, so I had a little bit of everything.
Yeah.
Had some people who are from China. They like to do their own thing. They or like they'll have family in there all the time, and they will either do it themselves or the family member will help. I have people from India, and with them, their sons and husbands will try to help, but mostly they prefer their daughters. And if it was a male caregiver or a PCA or SNA, whichever title you want to give you, they would ask for a female one and then still let the family do the thing. But if they need assistance, the female PCA will come in and help. But we'll mostly try to educate the family on the stuff that they need assistance with, how to do it properly, just so nothing else can happen. And we'll stay outside the room if they did need assistance. With the Latin American group or Hispanic, they are very family oriented. So there's always family members there that's asking a whole bunch of questions. They want to know every little detail. And you just got to be polite, respectful. And some of them don't speak very good English. So if they'll be embarrassed to ask questions because they know their English isn't very well. So you guys gonna make them feel secure to still be able to ask questions. Don't make them feel like because you can't speak English properly, I'm not going to help you or assist you. You can get a translating app, the translator that they have at the facility, and help them out so they can be more comfortable. So what I learned is no matter what cultural, I mean, I even had patients who only wanted males because he felt if a female was in there helping him, it would be considered cheating on his wife. So he didn't. He wanted male caregivers to help him out. So I just learned everybody's different. You ask them what is more comfortable with their needs, be very understanding, and try to accommodate them as much as possible.
Hey, what are you doing?
You just be there and be patient and respectful.
Oh, that's awesome. That's awesome. Really. I mean, everything that Ryan just put everything in a nutshell for all of us. Did he not? I mean, that's what it's all about. Yeah. Wow. Wow. Makara, people have switched around in their cameras, so I'm not sure. I know I've talked to Giselle. Makara, have you given us your...
Sorry, I almost dropped my laptop.
Go ahead.
I've dealt with a lot of different cultures and ethnicities. I feel like culture goes past ethnicities because Malika, we talk about it in class all the time. Like she's Asian too. I'm Cambodian, and our culture is still a little bit different. I work at a nursing home and I deal with a lot of Caucasians and I take care of them. I don't know, everybody's different. And I feel like it goes past race or race or ethnicity. I've traveled a lot. I feel like I connect with people a lot with like food, and once I talk about food, they just open up and tell me about their whole culture. My mom, she went to law school and she was studying about like the Muslim religion. And I don't see people do this in America, but I guess in the Muslim community, the woman would like sew their vagina up until they get married and then unsew it. I've never seen it here. Yeah.
No.
That's my mom read that in a book.
No, that's not true. I swear. We don't do such things.
That is true in some Muslim cultures. They sew it or they do
But different cultures,
take
but
off
not
the clit.
Hang on, Aaliyah. Hang on.
Yeah, they sew it or you can take off the clit. Like what they do for the baby boys, they would do it for the girls. So that
But
they are virgin until they marry.
But not everybody's the same. I'm just open
Sure.
to
Yeah.
everything. Like how Aaliyah said, she doesn't do it, but maybe
Others do.
someone
Right.
else does.
Right. Others do. Yeah. Yeah.
But
Ter-
the countries like
ter-
that
a li-
and the African nation Muslims, I think you're right about that, but mostly like the Arab nation, the Arabs,
well,
Pakistanis, the South Asians don't do it. That much I know. The South Asian Muslims do
okay.
not do it.
But others do. That's the point.
The
Other
African
others
American,
do.
African
Yeah,
Muslims
others
probably.
do. Okay.
Yeah.
Teresa, go ahead.
I feel like I had a lot of experience because I've been in the field for 15 years now.
Okay.
Home health, working in the hospital and long-term care. What I did notice is that I moved from state to state, so I feel like also like the states is different. Here
Absolutely.
in Pennsylvania, there's not a lot of African Americans or blacks or whatever you want to call them
Mm-hmm.
in the nursing homes, and when they do come, they come with a large amount of family members. So like we had one who was dying, and it was like somebody else said, like 20 family members a
Mhm.
day, and it's the workers at the facility don't really understand it, so like they might say a few things and seem rude because they don't understand it, like, oh, they're interrupting the other residents or it's too many
Exactly.
people, but that's just how like my culture and other black cultures and even some
Mhm.
Africans, that's just how we operate. It's not just
Mhm.
about the immediate family, like your mom, your dad, your siblings. It goes beyond that. And our
Sure.
immediate family is considered like cousins and aunts as well.
Mhm.
So that's just
Yeah.
something from
I
my
mean, yeah, thank you. I mean, this is why I wanted to save this discussion for the end, because look at what a lot of us have already experienced, right? I mean, cultural knowledge is going to be a lifelong learning for all of you guys as you go forward, whether it be with your clients, your family, your coworkers, right? You're going to experience, and look at what you've already experienced, right? Incredible. Incredible. Thanks for everybody for sharing. Appreciate it. I already learned, I learned a lot just from today, as I did Tuesday, as I did Monday. It's crazy. It's crazy. So you guys are well on your way. I just remind, open mind, non-judgmental, always be a learner, right? Always wanting to learn about different practices and different cultures. Okay. All right, let's jump into, I'm gonna look at a different screen here. So if I'm looking, so with regards to the preparing for your exam, okay, this study guide looks different. Okay, what I'm trying to do is get to what I'm trying to do is critical thinking for you and understanding the concepts. Okay, rather than memorizing a study guide. Okay, so based on your weekly notes from weeks 7, 8, and 9, based on your readings, and based on the notes that you've taken in class, that's what you need to use to prepare for exam 3. Okay.
Can you repeat that, please?
Pardon me?
Can you repeat that, Miss Marble?
I said, from the way you're going to prepare for exam 3 is your weekly notes that I give you, the notes you take during class, and your readings. Okay, so I'm actually wanting you to create your study guide. So I want you to go back and critically think about what you learned about each concept. Okay, trying to apply that into practice settings. Okay, I don't want you memorizing a study guide. If you review your notes, if you review the notes you've taken in class, done your readings, participated in the quizzes and the review of the quizzes, you'll be fine. Does that make sense?
The third exam is from week 7, 8, and 9, right?
Yeah, that's right on the concept study guide I gave you. It's week 7. There's 3 different concepts in week 7. There's 4 in week 8, and there's 2 that we just covered today.
Yeah.
All right, so go back. So for example, in my notes that I'm going with. So let me just review the topics underneath the concepts. hang on. So under your week 7 concepts for infectious disease prevention and control. Okay. Epidemiological triangle, right? Remember your agent, your host, your environment, right? We need to know about that. Hepatitis came up in that concept. Smallpox came up in that concept. Okay. And those are in your notes. And then the second concept was what was it? HIV, TB, and STDs. Under that, we learned about HIV, TB. With regards to STDs, in your notes was chlamydia, gonorrhea, syphilis, herpes, HPV. That's what you need to know with regards to those. Again, I'm just going through the notes here. Bioterrorism and disaster. There's two kinds. Natural and man-made. What's the difference?
Natural
Okay.
earthquake.
Okay. Different chemicals with regards to bioterrorism and disasters. There's 3, and these are in your notes. Your vesicant agents, like a mustard gas, your nerve agents, like a sarin gas, your blood agents, like cyanide. These are all in your notes. What I want you to know is what systems are affected by those 3 different kinds of agents. And again, those are in your notes. Okay. If you are prepping a family, let's say we've talked about nurses, the expectation of nurses that you can function in every part of a disaster, whether it's the preparedness part, whether it's the impact stage, whether it's the post-disaster. Okay, in the preparation stage, how do you prepare a family? Remember that kit we talked about? Go back and review your notes. What needs to be part of that kit?
Yeah. You
Okay,
have to have it
so
for 3 days.
those are in your notes. Okay, and then the other important question I want you to be able to answer is, let's say you're working post-disaster in family, people want to know, when is water safe to drink? Go back to your notes and pull that out. Okay. Week 8, home care. Big differences. The biggest difference with home care versus hospital care. Where's the care being done? In the home. It's individualized care. Right? Community resources. Go back and review your notes on community resources, right? Because that's where that's part of the culture discussion. What do you do if you're working in a community that has different cultures that you don't have any clue on? What do? We try and seek out community leaders, members, organizations that can help us, right? Case management. Remember, case managers, coordinators of care, right? Not all clients are case managed. Case managed clients are your complex, chronic, multi-need patients. Okay. And the example I gave with the other groups, and I think I gave in my review, is let's say you have a person who's had heart surgery. Okay. They have family. They live with people that can cook, get them to make appointments, get them to appointments. Okay. They're set. They don't need to be case managed. Families can go pick up equipment or organize deliveries versus the same patient that lives alone. Okay. That may need medical equipment, that may need PT, OT, nobody to help schedule them, no transportation. Those are the clients that are typically case managed. Multiple issues going on. Let's say substance abuse, mental health, comorbidities. All right. One thing I want you to, there are different ways that case managers communicate. Go back to your notes and look at the differences between the 4 ways of, excuse me, the 4 ways of communicating. Go back and look at the difference between collaborating, cooperating, compromising, and assertiveness. 4 different ways that case managers communicate. There's subtle differences, but there is a difference. So you given a scenario in which the case manager is communicating, which kind of communication is it? Is she cooperating? Is she compromising? Is she collaborating? What else in my week? Go back and review your delegation. What kind of clients can you not delegate to as an LPN? What one big category is from your notes. Unstable, right? You can't. And as you're delegating, what do you need to do? What's part of that routine? Specific instructions on what's to be done,
and
how it's to be done. Hang on, how it's to be done, information that needs to be reported or documented. Right? What if somebody comes to you and says, I'm new to this unit. You're floated to the pediatric unit. They've never worked there before. And they say, I've never worked here before. You're delegating. What do you want them to do? What can they do under your delegation?
Restock rooms.
Things they're comfortable with, right, Caitlin? Things that they are competent and comfortable doing. You cannot make them do things that they are not, like giving a neb treatment, or, if they've never worked with pediatric patients. Find out what the common ground is of what they can do. Make sense? So there's some delegation questions on the next exam as well. So, and then we just covered our week 9 concepts: human abuse and violence and cultural. So you already have the knowledge. We've already gone through the knowledge. We've gone through the knowledge in class. You have the knowledge in your notes. Now it's applying that to patient scenarios, clinical situations. All right? Make sense?
Mm-hmm.
Questions? Well, this is it for content. The next week is exam week and HESI week. So, I hope you've enjoyed the class over the last 9 weeks. Hope you've learned a lot about community nursing. There's a lot that goes on that we don't even think about, right, on a day-to-day basis. Who in the community, who manages the schools, who manages the hospice patients, who manages different maybe religious organizations or lots of different roles. Who keeps the workplace safe? Your occupational nurse, your school nurse, you've got your hospice nurse, your home health nurse, maybe your faith-based nurse, right? There's lots that go on to keep your community together with regards to healthcare. Lots of different roles, lots of different issues, lots of different populations. We talked a lot about vulnerable populations. Our communities are full of them. And that's what we do as community and public health nurses. Our goal is to make our communities as healthy and as safe as possible. And it's just not a one-man show. We're always collaborating, always working with our team members in the community. So hopefully you have a better understanding of what that public health community nurse does. So you don't test until next Friday. So if you guys get to studying and you're having trouble with certain concepts, reach out to me next week and we can schedule a tutoring session and go over what you're not understanding. Okay.
Okay, I have a question.
Yep.
So I'm kind of understanding, but I'm not really understanding how to correctly do the HESI prep assignment? Like, what am I like writing in each category for each thing? You get
Well,
what I'm
you're
saying?
thinking, like it says, think about the nursing process. So if you, I think that first box is anthrax. What do you want to know about anthrax? Let's say it's clinical settings. What might a patient present with? What might be the treatment? How is it spread? What do you educate? What would think about the nursing process? I don't need you
Like,
to
what
list out.
intervention would you?
Yeah. Just think it's whatever information you would like to recall as you're studying for the HESI. What do I want to know about an anthrax patient? What do I want to know about a post-op below the knee and amputation? What do I want to know about caring for a patient with cirrhosis? Right, you're gonna get out of this study guide what you put into it. It's your study guide for HESI.
Okay.
Okay, and remember, every topic on that HESI study guide represents some kind of a question. That's the topics that are being covered.
Okay.
Okay.
Thank you.
Yep. Anybody else have any questions? Okay. Well, reach out if you need anything before the next exam, okay? All right. Have a good, it's Friday.
I have a question before you
Yeah.
disconnect. Would you be like available Tuesday or Wednesday?
Hang on one second. Everybody else, if you have any questions, stay on. If not, everybody, you're all excused. Okay. Tuesday. Yes. Hang on. Let me go into my 1 second. Next Tuesday would be the 5th. I just need to see when I have all these other risk meetings. So it wouldn't be till the afternoon.
Like what
I have
time
a-
after? Like
what?
12 o'clock? Like
No,
12 o'clock?
12 o'clock I'm in a meeting. No, it wouldn't. Let me tell you what the afternoon. I have a HESI. I'm doing my HESI review at 3 o'clock. It wouldn't be till after that. So I could do
What about Thursday?
4 o'clock. Oh, Thursday? Yep, Thursday I'm pretty open. I have a couple of meetings in the morning, but what time on Thursday? 1:30.
Can we do after 3:30? Because that's when I get out of Sims.
Yeah. 3:30 that's 1:30. Hang on. What about what time do you get out?
3:30. I have class
1:30.
early in the morning.
What about 2 o'clock? Or 4 o'clock?
That's perfect.
All right, I'm putting you in right now so I don't forget. So next Thursday.
At 4 o'clock.
Sorry. I've got one. Okay. So next Thursday at 4 o'clock. Okay, you're set. I have you penciled in there.
Thank you so much. Hope that you have an amazing rest of your day.
Okay, you too. Bye.
Bye-bye.
Ali, do you have a question?
Yeah, I